If you take ibuprofen regularly for joint pain or a bad back, there is something specific happening inside your body right now that your doctor may never have sat down and explained to you. It is not a scare tactic. It is a documented, well-understood process. And once you understand it clearly, you will be in a much better position to protect yourself. Because the truth is, several of the most common medications in your bathroom cabinet carry real cardiovascular risks after age 60, and most people have no idea until something goes wrong. Let's start with the one that affects the most people: NSAIDs, non-steroidal anti-inflammatory drugs. That includes ibuprofen, naproxen, and diclofenac. These are the pills millions of people reach for every single day for arthritis, back pain, headaches, and stiff joints. They work. Nobody is saying they do not. But here's what happens in your body when you take them regularly, especially past age 60. NSAIDs block certain enzymes to reduce inflammation, but those same enzymes also help regulate how your kidneys handle fluid and how your blood vessels stay relaxed. When you suppress them, two things happen. First, your body starts holding on to extra salt and water. Your heart, which is already working harder than it did at 40 due to natural stiffness that comes with age, now has to pump a significantly larger volume of fluid through your system. For a younger heart, that extra load is manageable. For a heart already dealing with mild hypertension or early stiffness, it can push things past the tipping point. Second, NSAIDs cause your blood vessels to constrict, which raises blood pressure directly. And if you are already taking a blood pressure medication, certain NSAIDs, particularly ibuprofen, can actually block the effect of that medication, so your pressure climbs without you feeling a thing. The risk is not equal across all NSAIDs. High-dose ibuprofen, around 2,400 milligrams daily, and diclofenac carry the strongest cardiovascular risk. Low-dose naproxen appears somewhat safer, but the risk is never completely zero with any of them. And there is one more thing worth knowing here. If you take a low-dose aspirin every day to protect your heart, which many people over 60 do, taking ibuprofen at the same time can actually cancel out aspirin's protective effect entirely. That is not a small concern. That is a direct interference with something your doctor prescribed specifically to reduce your risk of a heart attack or stroke. The approach that makes sense is not to stop managing your pain. It is to have a specific, direct conversation with your doctor. Ask what the safest option is given your particular history. For many people, acetaminophen handles mild to moderate pain without the cardiovascular concerns. Topical anti-inflammatory creams and gels, the kind you apply directly to a sore knee or shoulder, work locally without affecting the rest of your body the way a pill does. And if an NSAID is genuinely the best option for you, the principle your doctor should be applying is the lowest dose for the shortest time possible. Now, there is another medication category that surprises people when they hear this, and it is something a significant number of people over 60 take every single morning: proton pump inhibitors, commonly called PPIs. You would know them by names like omeprazole, pantoprazole, and lansoprazole. These are prescribed for acid reflux, heartburn, and to protect the stomach when someone is taking medications that can irritate it. They are among the most prescribed drugs in the world. But they were designed for short-term use, typically 4 to 8 weeks, and a large portion of the people taking them have been on them for years, sometimes without ever revisiting whether they still need them. Here is the specific problem. Your stomach acid is not just there to cause you discomfort. It plays a critical role in absorbing certain minerals, especially magnesium. When you suppress stomach acid long-term with a PPI, magnesium absorption can drop significantly. And magnesium is what keeps your heart's electrical rhythm stable. When magnesium levels fall too low, the heart becomes electrically unpredictable. That can show up as palpitations, skipped beats, or more serious arrhythmias, irregular heart rhythms that in some cases can be dangerous. Beyond magnesium, there is an association, still being studied, between long-term PPI use and increased heart attack risk. The proposed mechanism involves nitric oxide, a molecule that keeps your blood vessels flexible and open. Some research suggests PPIs may reduce nitric oxide availability, which would cause vessels to stiffen over time. The causal link is not fully established, but the association has appeared consistently enough in large observational studies that it warrants attention. There is also a more concrete concern. Omeprazole specifically can interfere with clopidogrel, a blood-thinning medication commonly prescribed after a heart attack or stent placement. When the two are taken together, the protective effect of the clopidogrel can be significantly reduced. If you have been on a PPI for more than a few months, the question worth bringing to your doctor is simple. Do I still need this? And if so, can we use the lowest dose that controls my symptoms? Do not stop abruptly on your own. That can cause a rebound surge in acid production that is genuinely uncomfortable. But make it a conversation, and if long-term use is unavoidable, ask your doctor about monitoring your magnesium levels periodically. It is a basic blood test, and it matters. There are a few common mistakes people make around these medications that are worth naming directly, because they are easy to fall into, and the consequences are real. The first is treating over-the-counter as meaning safe for everyone. Ibuprofen and common cold medications containing pseudoephedrine or phenylephrine are available without a prescription, but that does not mean they carry no risk for someone with high blood pressure or a history of heart disease. Decongestants that contain those ingredients work by constricting blood vessels throughout your entire body, not just in your nose. For someone with hypertension or any cardiac history, that can cause a dangerous spike in blood pressure or trigger an irregular heartbeat. Safer options for congestion include saline nasal sprays, nasal steroid sprays that work locally, and humidifiers, none of which affect your heart. The second common mistake is stopping a prescribed medication because of something you read without talking to your doctor first. This applies especially to blood pressure medications, heart rhythm medications, and antidepressants. Stopping these abruptly can cause rebound effects that are significantly more dangerous than the concern that prompted the decision. If you have a worry about a medication, bring it to your doctor. That conversation is what leads to a safe adjustment, not stopping on your own. The third mistake is not mentioning supplements during medical appointments. Calcium supplements are a clear example. For years, high-dose calcium supplements were widely recommended for bone health, and millions of people still take them daily. But the evidence has become more nuanced. Calcium from food, dairy, leafy greens, fortified foods, is absorbed gradually, and the body uses it efficiently. A supplement, particularly a high-dose one, creates a sharp spike of calcium in the bloodstream that the body cannot fully direct to the bones. Some of that excess may deposit in artery walls, contributing to arterial stiffness and calcification. Several large studies have found a modest association between calcium supplements and increased heart attack risk, though the evidence is not uniform. The takeaway is not that calcium supplements are always harmful. For someone with diagnosed osteoporosis, the benefit to bone health may genuinely outweigh the risk. The takeaway is that this is a medical decision, not a decision to make at the pharmacy on your own. Your doctor needs to know what you are taking, including vitamins and supplements, every time you are seen. A patient I think about often is a woman named Carol, 71, who was managing arthritis, reflux, and what she called a lot of little things. She had accumulated 5 different over-the-counter products over the years and was taking all of them daily, assuming that because none required a prescription, they were all safe together. When her doctor finally reviewed the full list, 2 of them were directly working against her blood pressure medication. Once the regimen was sorted out, her blood pressure came down meaningfully within weeks, and she told me she felt more stable and clear-headed than she had in a couple of years. Recent guidance from the American Heart Association has reinforced that people over 60 with any cardiovascular history should have their full medication and supplement list reviewed regularly, not just at a major appointment, but as an ongoing conversation. The 2023 updated guidelines on NSAID use specifically recommend that patients with heart failure or established cardiovascular disease avoid NSAIDs when possible and use the lowest effective dose when there is no alternative. The most important thing you can take from everything shared here is this: the medications most likely to affect your heart are not unusual or exotic. They are the ones you pick up without a second thought. The action that makes the biggest difference is also not complicated. Write down everything you are taking, every prescription, every over-the-counter product, every supplement and vitamin, and bring that list to your next appointment. Ask your doctor to look at it together with your current heart health in mind. That single conversation, done once and updated regularly, is genuinely protective. If you have a spouse, a parent, or a close friend who takes several medications and has never had that specific review done, please share this with them. A lot of people are managing real health conditions and doing their best, and they deserve clear, honest information about what is actually in what they are taking. If this kind of straightforward health information is useful to you, consider subscribing. I share practical, evidence-based guidance every week, and I would genuinely love to keep helping you. Before you go, I want to hear from you. Is there a medication on this list that you or someone close to you takes regularly? Has your doctor ever walked through your full medication list specifically with your heart health in mind? Tell me in the comments. Your experience might be exactly what someone else reading this needs to hear.